chiropractic physician. I'm your host, Dr. Amy Loden, and I have today with me a guest who I'm delighted to share with you all. And she is just got so many fun things up her sleeve. I'm going to allow her to introduce herself, and we're going to jump right in. Dr. Peju, thank you for coming to the show, and tell us a little bit about yourself.
Oh, thank you so much for having me, Amy. It's my pleasure. So, I am an addiction medicine physician. I live in Pennsylvania right now, and I train in family medicine. So, that's where I had my initial training. Well, actually, not my initial training, because I had actually trained as a dentist prior to medical school. Yeah. So, I
Wow.
then I got an MPH from Johns Hopkins. Yeah, all that before medical school. So, but I am board certified in family medicine, and then I went into addiction medicine without actually doing a fellowship, but I got board certified in addiction medicine, and I've worked in academic medicine for most of my medical career,
Wow.
and I've also gone into other things like without leaving medicine completely, like writing. Obviously, writing was a part of my academic career too, but I'm also interested in just writing about life and writing about things outside of medicine and music and photography, and
Yes.
I'm really fascinated by the idea of you just, finding ways to bring everything together.
I
Yeah.
love that.
So,
And you're really connecting what many people think of as left brain, right? All the sciences with right brain, all the artistic stuff.
yeah, yeah. I actually think that the whole left brain, right brain divide is a myth.
I agree with you. Say more about that, though.
Yeah, I have this. I've said this in a talk before that the corpus callosum exists for a reason, and for anybody listening who might not be familiar with the anatomy, that's the part that joins the left and the right halves of the brain together. But on a serious note, the both halves of the brain are supposed to work together, right? So, and if we think about people like Albert Einstein, who was this great scientist, but he was also a musician. He played
Yes.
the violin, and there's so many other examples of people who were, very much scientists, but also very much into music and the arts. So,
Yes.
yeah, I really believe that strongly, and that's one thing I really advocate for.
Yeah, that's beautiful. There's I did not experience this in medical school, but I know now that there are actually medical schools that are working hard to have the arts and the musics and the different things
Yes,
as
yes.
part of their curriculum for
Oh,
the very
yes.
reason you're saying. Um,
Mm-hmm.
Very
Yeah.
cool.
Yes. So I
And
went
so,
to. Oh,
go ahead.
sorry, if I may. So I went to medical school at Penn State,
Hmm.
Penn State College of Medicine in Hershey, and that was the first medical school, at least in the U.S., maybe in the world, to have a department of humanities, a department
Oh,
dedicated
wow.
to the humanities. Yes. So
Okay.
there was a strong emphasis on the humanities in our curriculum. We were required to take humanities courses in our first and second year. And then even in our fourth year, we had a number of electives in the humanities that we could choose from. And then they had the Kinley Center for Humanistic Medicine, and they had all these programs, where that basically promoted the arts and music and all of that. So I'm really grateful for that exposure.
That's fascinating. So my brain
Yeah.
is going in multiple places right now. One of the things that I'm thinking about, and you stop me anywhere you want to jump in, but
Mm-hmm.
I'm thinking about the idea of trust in medicine. That's something that's important to me, and
Mm-hmm.
how we know that there's a disconnect between
Mm-hmm.
patients and physicians
Yes.
in terms of trust. And of course, you have Dr. Google or Dr. Chat GPT,
Exactly.
right? Like,
Yeah.
so those all exist. But I think at a fundamental level, there's a humanity disconnect.
Yes. Yes.
And I'm curious if you happen to know
Mm-hmm.
that medical school and others that are now doing it, what kind of outcome differences are they seeing in the doctors that they're graduating? Is it just that these are nice human beings, or what's
Yeah.
different about them
I
in the
think that,
care?
yeah. So I haven't done the actual research
Okay.
myself, but I keep hearing about how these things actually do make a difference in terms
Hmm.
of the kind of doctors that we produce.
Hmm.
And there's just that, there's so many different ways in which the humanities makes us more human, makes
Agree.
us,
Right.
better doctors, better able to connect with our patients. So, I mean, I can give anecdotal
Yeah.
examples without necessarily talking about hardcore research. You
Hmm.
know, um, examples of patients that there's let me see, where do I start from now? There's so many different examples I could think of, but I am a member of the Music and Medicine Committee of the American Medical Women's Association.
Cool.
And yeah, and I like to tell the story about our chair, Dr. Mary Roro, who is a psychiatrist, and she's also a musician. She's a singer-songwriter. She plays the violin and viola, and she's played since she was a kid. And as a child or a teenager, her mom would take her to the nursing home, hospital settings, and she would play for sick patients, you know. And there was this one patient who had been very depressed and hadn't spoken for a long time. And when Mary played the violin, she just like came out of it, and she
Wow.
lightened up and she started communicating and talking, and it was just so moving and touching. The nurses were so touched by that.
Wow.
But but probably even more significantly, it made such an impact on Mary, the young Mary.
Yes.
And she already knew she wanted to be a doctor at that young age, but she decided that she would incorporate music into her future medical career. And that's what she does.
Neat.
She works with veterans dealing with PTSD and
Oh,
other
wow.
mental health
Yeah.
issues. And she
Yeah.
incorporates music into her work.
Mm.
So that's one story. There's
Cool.
another story. Yeah, I mean, I have stories where I've incorporated music into my work, but I don't feel as if my stories are impressive or as impressive as.
Oh, stop that. Stop that imposter syndrome that's trying to come out. I bet your stories are just as good. And I was trying to think, like, how would I incorporate music? So you've already
Mhm.
done this. You've taken music and put it into your patient encounters.
So, well, I'll talk about yeah. So let me talk about my experience too,
Okay.
because for me, it was a bit of a challenge to incorporate. How can I incorporate music into my clinical work? I'm not a I'm not a music therapist, and so we like to give honor to whom honor is due, and respect the
Yes.
fact that music therapists are, they're professionals in their own way,
Right.
and they have specific training. But what a lot of us do is it's valid. It's not music therapy, but it's valid, and we prefer to use the term music medicine, so it's more
Okay.
general, and we're not presenting ourselves as music therapists because we don't
Hmm.
have that specific training.
Okay.
So when I was working and I've worked in a number of different facilities, but as an addiction medicine specialist, I was working this one facility where my main job was actually within the research center, and but I really wanted to stay connected with the patients, especially the younger ones. So I would run group sessions with our teenagers and our young adults who were there for inpatient addiction treatment, and talk to them about the developing brain and how
Hmm.
their prefrontal cortex wasn't yet fully developed, and that's why we can't
Yes.
always count on them to make the best decisions and all of that. So all that fun stuff. And sometimes I would talk about research. And then at one point I was like, why don't I incorporate, music. So I started taking my ukulele to the groups, and after talking about all that fun brain stuff,
Uh-huh.
I would end with music and sing, and then there was this one time when one of the patients had brought her ukulele. In fact, she hadn't planned on bringing it to treatment, but her mother apparently encouraged her to. And she had composed a song while she was in treatment,
Wow.
and then she shared the song with us and played, and it was so moving. I wish I wish I had gotten the words of the song,
Mm.
but I don't have them, unfortunately. But it's just,
Yeah.
that connection. Music connects us in a way that few other things can. So
Yes.
anyway, I ended up, taking my ukulele, and I mean, it wasn't all the time that there would be a patient who wanted to sing or play the guitar or
Hmm.
whatever, but they appreciated. I think they appreciated seeing that side of me. They
Yes.
appreciated the music and all of that. Yeah. And then I
Yes.
will talk about another colleague
Uh-huh.
who also has a very moving story. So another member of our music and medicine committee, Dr. Sidel Ross,
Uh-huh.
who trained as an anesthesiologist, and she had been working and got to the point of burnout, which a lot of us
Hmm.
experience that. A lot of us talk about burnout, and it got to the point where she actually decided to take time off of work.
Okay.
And it was during this time of self-reflection that she realized that. Oh, I forgot one minor but significant detail. As a little 6-year-old, she had said she wanted to be a singing doctor.
Oh, wow.
Yes. So the doctor part happened, but the singing part kind of got left on the
Left
back
behind.
burner.
Ah,
Yes.
okay.
So now, after experiencing burnout, she's self-reflecting and then realized that, wait a minute, I've been neglecting the things that really bring me joy, like music and specifically singing. Maybe I need to go back to that. So she went back to work armed with this new uh, level of self awareness. And then
Mhm.
one day she thought, I wonder what would happen if I sang at the patient's bedside.
Oh, wow.
Yeah. And then her opportunity came. She had a patient who had terminal cancer, and
Mhm.
he had been a professional jazz musician.
Mhm.
So she would sing with him, and when he was strong
Nice.
enough, he would sing. And
Yes.
then his dying wish was to have a bedside jam, his dying wish.
Oh,
And
wow.
guess what? She organized it for him.
That's amazing.
So she sang. She got someone to play the trumpet and
Uh-huh.
someone to play the saxophone, and they gave him his dying wish.
Oh,
And
so
short,
beautiful.
yeah, and shortly after that, he was gone. But
Wow.
think about the difference that that made.
Yeah, absolutely.
Yeah, in that patient's life,
Mhm.
and then now she too incorporates music into her work, and it's just beautiful. It's wonderful. It's to think
It,
that we can connect with ourselves, but also
yes.
connect with patients and make it such a difference in their lives. In addition to the medicine we're giving them, in addition to
Yes.
you know all the medical stuff, this
Mhm.
adds another layer of healing,
Yeah.
another layer of connection, and
Mhm.
I think we've neglected it for too long. So I'm glad that there's more awareness of
Mhm.
the significance of music and the arts in healthcare.
Oh, that's fantastic.
Hmm.
And
Hmm.
in some ways, I think back to allopathic medicine versus
Hmm.
osteopathic and how very early on and there was a division and it was like
Yeah.
allopathic was more sciencey and osteopathic was more hands-on and that's never resonated. I actually think
Exactly.
the osteopaths have it right that there's more to us
Yes.
than just our bodies. We have
Exactly.
minds and
Exactly. Exactly.
spirits. There's
Hmm.
just so much more to what
Hmm.
it means to be holistic. And so
Yes. Hmm.
as you've gone through this journey and you've looked at these different things and experienced them yourself,
Hmm.
do you ever look back at your, let's say, your 20-year-old self and say, "Don't worry, it's not going to turn out how you plan, but it's going to be amazing"? And what would you tell your 20-year-old self, knowing everything you know
Yeah.
now?
Yeah. Probably something along those lines.
Yeah,
It's not going to be perfect, but it's okay. It'll
it
work
is okay.
out.
Yes.
And I really, really believe that. And
Hmm.
I look back at my life now and think about decisions that I made at certain stages of my life and all of that, and all the uncertainty and all of that. And it's like, at the end of the day, it all worked out.
It
It all
did.
worked out.
Yeah.
It's not about always making the right decisions, but even our so called mistakes are all
Yes.
part of the process.
Right. And learning
Our
from
ex-
them.
exactly. We're supposed to learn from our mistakes. We're not, so it's all a journey.
Yeah.
It's all a journey. And I think that, yeah, if I had, I wish, yeah, I could wish that my younger self had been less perfectionistic, less hard on myself, um, had more faith in myself, more trust in my own intuition, but again,
Right.
it all worked out,
Yeah.
and it's all working out.
And if you hadn't had that experience, would you be where you are today?
Exactly. Excellent point. That's an
I like
excellent
to
point.
remind myself that every decision I've ever made has brought me to this exact moment, this conversation I'm having
Exactly.
with you, right?
Exactly.
And if I had made different decisions, we wouldn't necessarily be having this conversation. And so
Exactly. Exactly.
I agree with you. It's important to have a growth mindset and
Hmm.
to fail forward and to take those and make
Yes.
meaning from them.
Yeah.
Um, as you think about where you started in medicine, and we'll
Hmm.
stay with the non-dentistry medicine right now, but where we started in medicine
Yes. Yes.
and where you are now, there's probably some big shifts that happened or some
Hmm. Hmm.
realizations that you're going to take a different path, that it wasn't necessarily what was sold to you of what
Hmm.
being a doctor looks like.
Hmm. Hmm.
And as you think about that, are there any types of things that stick out in your mind or stories, real change points that you look back and you're like, wow, I'm either really glad it happened because it was amazing or really glad it happened because it wasn't and I grew, you know what I mean?
Yeah, sure.
Anything
Great
that comes up?
question. Thank you. So, After my residency, I went to what was then a brand new medical school. It was called the Commonwealth Medical College. Now it's part of Geisinger, Geisinger Commonwealth School of Medicine.
Hmm.
And at that time, it was a brand new medical school. I got there literally a few months after the first students arrived.
Wow.
And yeah, and there were, you know, it was hard to know what to expect. But again, being a brand new school, it wasn't just a new medical school, it was independent. So now it's part of Geisinger. So it's part of this huge health care system. But then it was independent. It wasn't part of a healthcare system. It wasn't part of a university. In fact, my dad, who my parents have since passed away, but then my dad was still alive, and he couldn't understand. He kept asking, "So are you part of Penn State?" Are you part of it? Like he couldn't understand how a
What
medical
system
school
is this?
could
Yes.
just be a medical school and not part of a
Hmm.
university or something, you know.
Hmm. Yes.
And and so being at a new medical school had its challenges, you know, but it really did have a lot of challenges, and but they survived and they're thriving, you know.
Yes.
And I think of all the things I was able to do because I was at this new school, that I would not have been able to do if I had been at a more established place. I mean, and I think about the fact that when I went there, I thought that they were going to start a faculty practice. That was the
Hmm.
plan, and that didn't pan out. Of course, the students and the curriculum and all that was a priority. So
Yes.
starting a faculty practice was not the priority. And I knew I wanted to stay clinically active. So I had to get creative and find ways of practicing um, outside of the institution. And that, you
Yes.
know, had its challenges. And but I learned so much along the way. I learned so much along the way, and I was able to, like, you know, basically carve follow my own path. You know, I already had this interest in addiction medicine. I wasn't really sure if I wanted to do a fellowship or not, you know, and all that. But it all just worked out, and I basically got the experience that I needed in addiction medicine. I was the became the medical director of a new methadone clinic, because they needed somebody
Yeah,
and I
you were
happened to be
there,
available and interested. But got
available and
experience with
interested.
that. Yeah. And I worked in other facilities. And before I left that system, after they became part of Geisinger, they asked me to become the program director for the Addiction Medicine Fellowship. You know,
Hmm.
so by then I'd gotten my board certification and all that. Things, you know, things worked out. You know, it might have not been ideal. You know, here I went there thinking that, oh, we'd have this faculty practice and blah blah blah.
Hmm.
It didn't work out that way, but it still worked out.
Yeah.
It worked out a different way, you know. And yeah, and I think about other positions that I could have taken, but if I had taken them, I wouldn't have followed the path that I did that led me to becoming, you know, specialized in addiction medicine and gave me this, you know, this just, you know, gave me this how do I put it now, established me in this specialty, so to speak.
Yes.
It helped me to get established
Right.
in this specialty, yeah, which turned out to be just right for me, you know.
Yeah.
And then more recently, I've worked at other facilities in between, but another methadone clinic, I worked there as their medical director for a year and a half or so. And a colleague and I just, I was telling you about my books, some of
Hmm.
my books earlier, but a colleague and I wrote a book about navigating the methadone maze for patients who were getting into methadone treatments and trying to
Oh,
figure everything out. Yes, so, and that just came out earlier this year. And
oh,
now we're working.
congratulations.
Thank you. We're working on one on buprenorphine,
Hmm.
Suboxone. Yeah, and because there's so many patients that are out there and that really need information. So
Right.
yeah, and I'm all about, you know, sharing knowledge and making knowledge accessible to
Hmm.
people. So I really, yeah. So yeah, I said earlier that I like writing outside of medicine, but I still
Hmm.
want to educate people about medical topics too,
Yes.
especially the ones that are relevant to my specialty.
Absolutely. So, actually, why don't we spend a couple minutes talking about that? Because I would imagine that our listeners, most of them may never need to see an addiction medicine
Mm-hmm,
specialist
mm-hmm.
and may not even know the specialty exists, but I bet there's somebody who knows someone who needs your help.
Yes.
So,
Yeah.
tell us a little bit about what is addiction medicine? What do you help people do? These
Mm-hmm.
are, not terms that most people probably have even heard of.
Thank you. Okay, so addiction medicine is a specialty that actually you can go into from any specialty, you can go into addiction medicine from any medical specialty. To become an addiction psychiatrist, though, you have to be a psychiatrist. All right, so addiction medicine is practiced by both psychiatrists and physicians from other specialties. Uh, but for psychiatrists, it's addiction psychiatry. So
Okay,
they're both considered specialties in their own right, even though we end up
got it.
treating the same patient population. Yes,
Okay, that makes sense.
and I think starting from next year, people who want to become board certified in addiction medicine will have to do a fellowship. But
Okay,
up till now, it's there's been a praxis pathway where you don't have to do a fellowship to take the board exams and yeah.
okay,
But
yeah,
in terms of who we help, well, you see, you made a comment about how the listeners probably don't have addiction problems and stuff like that, and I would imagine you're right, but you can hardly find, I think it would be much harder to find anybody who hasn't been impacted one way or the other, who doesn't know somebody or know a family
yes,
who's
yes,
been impacted by addiction, and unfortunately it's a disease of that affects the whole family.
yes.
It's not, so yeah, so people can be addicted to any number of things. I mean, I've worked mostly with people who have opiate use
Uh-huh.
disorder, but alcohol is a big
Yes.
problem, and then other substances, cannabis, cocaine, stimulants. Yeah, so
Yeah.
there's a very wide range, and then there are different types of facilities. There's outpatient facilities, there's inpatient facilities. Um, uh, a lot of the opiate treatment programs are outpatient facilities, like the methadone clinics, where they traditionally had to go in every day to get treatment. Now they're trying to loosen things so that they don't necessarily have to go every day, but that's how they were set up in the US, where you had
Okay.
to go to patients who were on methadone maintenance had to go to clinic every day to get their methadone. So there's a number of changes. I think with COVID, when the regulations had to be relaxed, and then they saw that there wasn't an increase in overdose deaths and things like that from the relaxed regulations. So
Uh-huh.
now they're trying to modernize things and make it less cumbersome for patients to be on methadone maintenance, and increasing the amount of the number of take homes they can have, so they don't have to go to clinic every day and that sort of thing. But it's not just the methadone anyway. It's there's
Yeah.
a counseling. Sorry, somebody.
You're
There's a
good.
counseling component. We always tell people they need to have a support system. There's so many things that play into whether or not a person is able to maintain their recovery. But we do our best. Again, but I tell patients, it's not a magic medication.
Right. Right.
It's just one part of your treatment. So whether it's methadone, whether it's buprenorphine, Suboxone,
Yes.
Subutex, whatever,
Yes.
it's just one part of your treatment. And then spirituality too is a big part of addiction, and at least that's something that people generally recognize and acknowledge. Yeah, there's a huge spiritual component to treating addiction, and yeah, so
So say more about that because that's not something I heard a lot about in medical school. Tell
probably not. You probably didn't hear much about addiction, period, in
We
medical
didn't. We
school.
didn't. And in fact, I was just thinking as you're talking about it, you're right. I know people in my personal life who are
Hmm.
addicted. I think
Hmm.
everyone does know that
Hmm.
story. What I and I don't in any way mean this in a
Hmm.
mockery form. What I
Hmm.
hear many of my patients come in and talk about is sugar addiction.
Oh
And they kind
yeah,
of blow it off. They're like, I'm addicted to sugar.
yeah, yeah.
And like I get the way they're saying it is kind of a joking.
Hmm.
And again, I'm not trying to mock at all
Hmm.
those who are struggling with the addictions you're
Hmm.
describing. I do wonder, kind of along the line of the spirituality you were referencing, or just the brain itself, like how
Hmm.
the brain is responding to these different types of compounds.
Hmm.
Um, there's a reason people get addicted, right? It's
Yeah. Hmm.
not as cut and dry as we like to often think
Yeah.
in medicine.
Hmm.
So, anything along those lines, anything you want to, where do you want to go with that? I gave you a
That's
big open
interesting.
wide.
Yeah, yeah, yeah. Well, at least people are beginning to accept that it's a brain disease. They're beginning to understand. I mean, a lot of people probably still don't get that, but I think the awareness is increasing that it's a brain disease. It's not a moral failure. In the past, it was just seen as a moral failure.
Yeah.
Why can't you just stop using cocaine or
Yeah.
heroin or whatever? But we have evidence that the brain does undergo changes with addiction. So if a person's brain is sick, so to speak, you don't just assume that they can just get over it on their own.
Right.
You know what
Right.
I mean? And some people need medication. Many people need medication. You will sometimes hear about people who just stopped miraculously, but a lot of people need treatment, and sometimes that treatment involves medication. A lot of times it does, especially with opioid use disorder. Um, it really, and so people can heal, they can heal, but they need help and support.
Yes.
And so medication, counseling, spiritual support, again. And so there are groups like I'm sure you know about AA, NA, and all of that, where
Yes.
they they meet with other people who are in recovery, and
Yes.
basically have like a support system, and there are different types of support groups. Not all of them are, not all of them may emphasize spirituality as much, but I think in the groups that do emphasize the spirituality part, it's like just acknowledging that there's something bigger than you. There's your higher power, So and surrendering to your higher power. So for
Yep.
many people, it's God, but
Yes.
even for people who don't believe in God, just recognizing, acknowledging that there's something bigger than you.
Yes.
Um, and and yeah, because I mean, we can study all the science in the world, but I think many
Yeah.
of us believe and understand and agree that there are some things that science can't explain, and there are things
Right.
that are bigger than ourselves, and sometimes we just have to surrender to God or your higher power.
Yes.
Yeah.
Yeah, it's interesting that you bring it up, and we were kind of chatting a few minutes
Mhm.
before the show started. Like in medicine, there is a pretty clear mark that you just don't dive into some of these things as a doctor, right? Like you don't talk about spirituality, you don't talk about faith, and yet studies that have been done say patients want their doctors to talk about
Exactly.
this. And so
Exactly.
that's why I find it so fascinating when you're saying this. That there's a spiritual component.
Mhm. Mhm.
I'm internal medicine by background, and we do a
Mhm.
lot of hormones and weight loss and menopause,
Mhm.
but we're not generally talking
Mhm.
about spirituality because
Yeah.
it doesn't even come up.
Mhm.
I'm hearing kind of the subtext what you're saying. I'm hearing that it does come up in your practice, and in your colleagues, not just yours. This is a thing that your specialty sees.
Yes, I think addiction medicine is one area where it's generally accepted that
Yeah.
spirituality is important. Yeah, and yeah, and but I think it's uh, I think people make a mistake when they think that they shouldn't address spirituality at all with patients in general, even outside of
Yes.
addiction,
Yes.
because it really is, whether it's outright religion or just spirituality in general. For many, if not most people, that forms a significant part of their lives.
Right. Yes.
So why not address it?
And many people make decisions based on how they feel,
Exactly, and
and what they believe. Yeah,
and what they believe
absolutely.
about God, and
Mhm.
yeah. So
Yeah,
yeah.
it's just such an interesting point you raise because, my background is in the Christian faith, and it's so
Hmm.
interesting to me
Hmm.
to talk to people, especially of different faiths. Sometimes
Yes.
they want to talk, sometimes they don't. But
Yes.
we don't do a great job. I don't do a great job of bringing it up. But sometimes when these conversations happen, I'm like, "Do you want to talk about this? Do you
Yeah.
want me to go here, or do you want me to
Hmm.
stay out of your
Hmm.
business?"
Hmm.
And it's just really, I think you're right. I think people want to be seen and heard in their
Hmm. Hmm.
totality
Hmm.
and not just given a label that
Hmm.
they identify as different things.
Yes.
And if someone does identify, like myself, if I identify as a Christian and my
Hmm.
doctor doesn't want to acknowledge that faith plays a role in my life, that
Hmm.
I'm going to find a different doctor, frankly, because I need somebody who
Exactly.
sees me as a whole,
Exactly.
and it respects my decisions as a whole.
Hmm.
Um,
Hmm.
but that definitely was not something I learned. If they taught it, that must have been the day in medical school I wasn't there, because I don't recall this.
Yeah.
And so it's
Yeah.
interesting.
Yeah, and so back to my medical school again,
Yes.
because the humanities was a big part of our education. We talked
Yes.
about spirituality and healthcare, and yeah.
Hmm.
So I mean,
Yeah.
I'm not. they probably could have done even more, but at least it was
It was
addressed.
there. It was there. Yeah, I think the most we talked about it was maybe in the context of certain faiths have different beliefs about blood transfusions, for
Yes, yes,
example, or
yes, yes.
abortions. And so there was these different things,
Yeah.
carve outs,
Hmm.
but it was never seeing the person holistically, which is really what
Hmm.
you're advocating for. And so let me pull your music back in here for a minute. You've written several books,
Hmm.
and a couple of these at least talk about music. So tell us about your books. Tell us about the journey that you started writing them and who you
Oh,
designed them for, wherever you want to go with that.
okay, thank you. All right. So when I was a teenager, I knew my parents wanted me to be a doctor, and I was like, oh, I like writing. I like writing, and they're like, oh, that's something you do in your spare time. Just kind of like, yeah. So anyway, so writing got pushed to the back burner, but there was always a writer in me, and as an academic physician, I had to do academic writing, but I also just got to the point where I wanted to just write. I didn't want to have to keep dealing with peer review and rejection and resubmission and all of that. I wanted to just write
Oh,
and express
nice.
myself, and and so I just started doing that. And then I had gotten into photography along the way too. So, at one point, I think around 2015, 2016, I realized that I wasn't going to have, it was going to be a while before I would have the time to write like a full-fledged book, like an autobiography type of book or that
Yes.
sort of thing. But I had the idea, why don't I start, putting my pictures, because I wanted to share my photography as well into books, and then I can write a little bit about the pictures and all that, but it's not going to take forever because it's not that kind of book.
Right.
So I started with a book about Scranton, photographs about Scranton, Pennsylvania, where I was living at the time, and 2016 was their 150th anniversary, the city's
Wow.
150th anniversary. So
Neat.
that, yeah, so that gave me 2016 was that, yeah. So 2015 was when I found out that the following year they'd be having this anniversary. So that gave me a deadline because I'd been thinking about writing having a picture book with pictures from around the world, places that I had been, and
Uh-huh.
that was going to
Cool.
take a while. But I was like, why don't I
Yes.
start local? Yeah. So my first photo book was published in 2016, and then and then after that, I followed with the first butterfly book, and then a couple years ago, when I left my last full time job, because I don't. I mean, I still do some clinical work, but not
Hmm.
full time. So when I left my last full-time job, I had some time on my hands, and then I've been working on this devotional based on proverbs, like a
Okay.
proverb a day kind of thing,
Yes.
living foolproof wisdom for daily living. And so I worked on, and then wanted to kind of take my writing and publishing to the next level. So I worked with a coach who helps me figure out how to put it on Amazon and all of that. So
Okay.
so that was the first book that went on Amazon, and then she encouraged me to put out a second edition of the butterfly book and make it look nicer. Work with um, a graphic designer who could redo the layout and all of that. So after that, I was just on a roll, and then I redid the Swanson book, and then and then put out a giraffe book. And then
A
I was
giraffe book. Nice.
yeah, and then I had a workbook that was the first one that had any clinical that was clinical, a workbook for patients in recovery, like
Uh-huh.
or with other behavioral issues, and it's basically went through the stages of change in behavioral health,
Hmm.
pre-contemplation, contemplation, and all, and then compared them with the stages of the butterfly's life cycle, and then it had,
Oh, neat.
yeah, and then it had case studies and all of that, yeah, and then
Okay.
yeah, but um so this, I shouldn't say but, like this September, I put out what till then was probably up till then my most significant book, which is
Okay.
titled Girls Become Doctors and Much More. And it wasn't intended as a memoir, but it ended up becoming something of an academic memoir. But I introduced people to several women physicians that I've met
Uh-huh.
along the course of my career, and then there's a historical portion in the beginning where I talk a little bit about Elizabeth Blackwell, and then other early women physicians, the first African American female physician, the first Native American female physician. I talk about
Cool.
Ida Scudder, who was a missionary to India and had an
Uh-huh.
incredible story. But most of
Wow.
them are contemporary, and they're people that I've met along the course of my career,
Okay.
and I highlight them.
Hmm.
And So this came out in September,
Mm. And
and
it's on Amazon now?
it's on Amazon.
Okay.
basically available where books are sold because it's available through Ingram too, so
Okay.
bookstores can order it through Ingram. But yeah, definitely on Amazon. And then so back to music. Sorry,
Hmm.
I'm going back and forth.
You're good.
So, so 2022, late 2022, when I took that time to finish writing the devotional book, I also started recording Christmas music, which was something I'd wanted to do for a long time. And then that year, we just released one song of The Little Drummer Boy, but then the following year released the whole album of 13 Christmas songs.
Okay.
So I sang, and my producer did most of the instrumentals, but I did a few instrumentals here and there.
Neat.
And then, yeah, and so I think it was this. So that was released in 2023, and then I think that Christmas season, I was in a service, and we had these flyers or handouts that had the story behind "Oh Holy Night," and I remember reading it and thinking, this
Yeah.
is fascinating. And then I had this idea: what if I went and researched the stories behind all the songs on my CD
Yes.
and wrote a book about them,
And so
So
you did.
I did. And so that was December of 2023. And I already had writing commitments for the first half of 2024. So literally, I started writing the book in June of 2024.
Yes.
And it came out just in time for Christmas,
I love that.
November 2024. So the first edition came out last year, just before Christmas. And then, for a couple of reasons, I decided to put out a second edition this year because, well, a couple of things. There were a couple of minor updates here and there,
Hmm.
minor edits and updates. But I also had Dr. Mary Roro, who I
Okay.
mentioned earlier, the chair of our Music and Medicine Committee. I had her write a forward. And then
Okay.
I also included a postscript with some funny stories about Christmas caroling in Nigeria and how we made up the words to some of the songs that we didn't know, like Feliz
Yes.
Navidad. We messed up
Uh-huh.
the Spanish part. Yeah, so
Oh,
yeah, I thought that would be an interesting addition. So that's in this second edition, which just came out this October. And then just last week, I have this devotional, Heartfelt Offerings, that's based on the stories in this book. So people can read the stories and then go through the devotional. There are questions for reflection, there's
hmm,
suggested activities, and then some of the days just focus on mental health or wisdom
yeah.
pearls. But for the most part, they're focused on the stories in I Played My Best for Him. Yeah.
I love that. I love
Thank
that.
you. Yeah.
And I mean, we hold these books up and we think this is just a book, but it's actually hours and hours of
Yes.
work and
Oh,
research and
yes. Oh,
thought and
yes.
redoing it.
Yes.
It is a lot of effort. So,
Mm-hmm.
first of all, thank you for doing that work and for putting that
Oh,
out in the
oh,
world.
thank you.
Um,
You're welcome. My
and
pleasure.
certainly encourage our listeners to get that, whether you said it's at Amazon or anywhere books are
Yes.
sold. So, that's really probably more of us could be giving more if we took the time to be as intentional as you've been about it. So
Oh, thank
that's what
you.
I'm taking away from that as well. I got a lot of work to do. Let's go.
Oh,
Um,
oh
but
well, thank you.
I
You're so
love that. Yeah.
kind. You're so
Well,
kind.
it's true, right?
Yeah.
And this seems to be your calling.
Oh yes, oh yes,
Yes.
yeah. And it's interesting that you said that because I remember when I was younger, I kept struggling with this idea of, oh, what am I supposed to do with my life? What does God want
Hmm.
me to do?
Yes.
And and this constant doubt: am I doing the right thing? Am I really in God's will? And am I,
Hmm.
and you know what we were saying earlier? Things work out. Things work out.
Yeah.
And when it was time to start writing, I just started writing.
It was
I
there.
didn't need to have a special revelation. It just
Yes.
it just
Yes.
started coming out of me. I just did it.
Hmm.
When it was time to write this book, I played my
Right.
best friend. I just knew it was time, and I just knew it was the right thing to do.
Yes.
And for people who might not know, so I played my best for him is from the Little Drummer Boy, the Christmas song.
Hmm.
And it's a fictional story in the song about this little drummer boy who didn't have any gifts to bring to baby Jesus. So he did what he could do. He played his drum. And
Yes.
I just feel that that has such a strong and deep message, that
Hmm.
it's not about all the gifts. Oh, Christmas is coming. It's not about all the gifts and all that. No, but what giving the little that you have,
Yes.
using your talents to, to bless people, to bless humanity, that your
Right.
talents were given you for a reason.
Yes.
Not everybody's going to be famous. Not everybody's going to be, uh, uh, a superstar or
Yeah.
whatever.
They're
But
not supposed to be.
exactly. So the little drummer boy, he played his best.
Mhm.
And I just, that song just, it just pulls at my heart. And I think that it's a message that we can all take away from it. And i
Yeah.
i struggled, I still struggle with imposter syndrome,
Yes.
but um but as a young child, as a young adult, I really, really kept feeling like I wasn't good enough. I wasn't good enough, and
Right.
nothing I did ever seemed to be good enough. And but you know what? You are enough. You are
That's right.
enough. Just do your best.
And we say that so often to kids, and then my kids are starting to get to the point they're like, well, what if my best is a, I don't know, we'll pick a grade, a
Isn't good
C,
enough.
right? And they're like, what if I make a C? And I'm like, so what? You made a C. Like, is if
Exactly.
that's truly your best, I'm not going
Exactly.
to validate you being lazy and not
Exactly.
doing your best. But
Exactly.
if it is your best, then that's great, because every one of us, I think you're right. Whether we think of imposter syndrome as kind of a female thing, but I actually think it's a human thing. And
Yes.
I think it
Yes.
shows up in different ways at different
Mhm.
times in our
Mhm.
lives. But
Mhm.
for certain, I've watched as my children get older, we all want to be seen. We want to be
Yes.
heard, and we want
Mhm.
to know that we are worthy as we are. And we
Yes.
spend so much time and energy and effort looking for external validation when,
Mhm.
as a Christian, I believe God says you are already worthy
Mhm.
because you're made in my
Yes.
image.
Yes.
And so letting people just be and
Mhm.
supporting them and taking that next best step, whatever that thing is,
Exactly.
and whatever your calling is. And my
Exactly.
gosh, if we all had the same calling, we'd all be boring, right? So
Exactly. Exactly.
it's good.
Thank you for saying that. I know.
Absolutely.
Yeah. I like to tell people, stop trying to be normal.
Right.
Just be that unique person that you were
Yes.
created to be.
Yes. And when you step into that, it's scary. It's supposed to be scary because you're growing in that skill.
Yes.
And
Yes.
so normalizing the scary, I find to be
Yes.
very empowering for myself.
Yes.
So,
Yes. Yeah.
well, we are almost at time. This has been just fantastic to hear from you. I had no idea we were going these places, right?
Yeah.
Very interesting. I learned so much from you, and thank you for taking the time to be here. If
Oh.
you were to leave our listeners with just one thought of wisdom or something that they can kind of tuck away and go with, what would that be?
Oh, thank you. It's my pleasure, and thank you for the opportunity. Yeah. So, I already talked about stop trying to be normal. Right? I already
Yes.
said people should stop
Yes.
trying to be normal. But one thing I'd like to add is that, because I like to look at examples from nature. So, I'm into butterflies. I talked about the butterfly book. So, how do the monarch butterflies know how to get to Mexico? They fly to Mexico for the winter. They fly down south to Mexico to warmer weather for the
Yes.
winter. But how do they know when it's time to go or how to get there? How does the caterpillar become a butterfly? When it's in the chrysalis and everything, what exactly is going on? And
Yeah.
and then I realized that there's something called an imaginal disc, and I haven't studied it too closely, but there's something called an imaginal disc, and it basically has the information that the adult butterfly needs to develop. Yeah. So again, I might not be explaining this very well, but what I take away from that is that each of us has our own equivalent of the
Mhm.
imaginal disc. You have what it is that you need to
Yes.
become the adult version of you.
Yes. That's beautiful.
So God created you as a unique, beautiful human being. So just trust that, trust the process,
Yes.
and don't look outside for external validation. You have what you need to become the real you,
Yes.
the fully
Yes.
mature you. It's inside of you. So yeah, it's something that took me a long, long, long time to realize that.
That's beautiful. But you're on the path that you're supposed to be on.
Yes,
And if you feel like it's not the right path, listen to your gut and keep moving
exactly.
forward and take that next best step.
Exactly.
Good
Exactly.
stuff. Good stuff. I love that.
Exactly.
Well, I am going to go check out your books. I have lots of
Oh,
nieces who
thank
need that
you.
doctor book. So
Oh,
thank you
great.
for the
Thank you so
suggestion.
much.
This is, like I said, just been a real pleasure to talk to you and to have you here. So
Thank
thank you for
you.
coming on.
You're, you're
And we'll love
welcome.
to
My
have you
pleasure.
back.
Thank you
So
so much, Amy. My pleasure.
happy to see you. And listeners, stay tuned for
Same
the
here.
next episode of The Authentic Physician. We'll see you soon.